in school books got you weighed down? Chuck them. Let's get back to the basics.
Weighing me down.
Hi guys, my name's Emma. I'm a 4th semester nursing student, and today we're going to be going over a foundational care concept. So if you're in school, I'm sure you've heard of it before. We're just going to go over an overview, break it down, go back to the basics. Or if you just got accepted, you're in your 1st semester, you just started, I'm so glad you guys are here. Welcome. So yeah, today we're just going to be going over, and I'm sure you'll recognize it when I say it, but we're going to be going over, drumroll please, ADPIE, and we're going to talk about what that means and ways to use it. And I still find ADPIE helpful in answering test questions. Sometimes when I'm confused on a test question, or I'm not sure, or I'm down between like 2 answers, it's like, okay, let's go back to a mnemonic that they taught us in 1st semester, and let's try to see if this applies to that. Because most likely, it may not have the words assess, or diagnose, or intervene, implement in it, but you can still apply it to that mnemonic and be like, oh wait, we still need to do this portion first. So anyway, let's dive right in, guys. Today we're going over ADPIE, and I have it written up on my whiteboard here. It's ADPIE, and each letter stands for something. So we're going to start at the top. So the A stands for assess. There's 2 portions to assessing a patient. You have subjective data and objective data. And the subjective spoken. It's what the patient tells you. So when the nurse is like, hey, can you tell me your pain level 0 to 10? And the patient's like, yeah, my pain's 5. So that would be considered subjective. Like the spoken report, like they telling you history about their medical history, that sort of thing. And then there's objective data. Think objective, observe. It's what we see. So like the vital signs, the head to toe assessment, when you listen to heart sounds, what you hear, when you listen to lung sounds, were there crackles, wheezing, when you look at the patient's skin, was there like bruising, was there any open wounds? That would be considered assessing during the head to toe assessment. So lab values, that would also be part of an assessment. So you have your assessment first. You're going to do that first and foremost. And then you're going to diagnose. This is different than a medical diagnosis that like a provider does. It's an RN's judgment call on actual and potential issues. So you'll get a book, like a nursing diagnosis book, that it's pretty thick and like it'll have all these sorts of diagnoses, and maybe like risk for impairment, or it may be an actual impairment. And you will look through there and you'll pick one that applies to your patient. It's part of like a care plan or plan of care. You'll hear those words used. So once you do these 2 things, then you're going to make a plan for your patient. So the plan is like the goals and outcomes that you want the patient to do in order for them to increase their care and to get better, to become healthier, if that makes sense. So for example, let's say a patient's cholesterol is high. It's over 200. So, and we've determined that by doing blood work. So going back to the assessing, we've done blood work, their cholesterol's high, we've taken their BMI, their height and their weight, and their BMI is a little high, and then they subjectively told us, like subjective data, that they have a sedentary lifestyle and that their job doesn't allow them to get up and move a lot. They do like a lot of computer work, for instance, or they do a job where they aren't getting up and moving regularly. So with that being said, we've assessed them, and then we're going to diagnose a nursing diagnosis for them, and then we're going to make a plan of, okay, we want them to increase their activity level, we want them to get healthier foods in their system in order to decrease their cholesterol. So then we're going to implement that plan, and implementing, there's also a lot of education in that part, because in order to implement and do the intervention for the patient, sometimes we have to educate them on things that the patient actually needs to do in order to meet the outcome, if that makes sense. So implementing for the cholesterol patient may be, okay, I'm going to give you 3 exercises I want you to do a week, or hey, how about this next week, every 1 to 2 hours while you're sitting there working on your computer, I want you to try to get up for 5 minutes every 1 to 2 hours and just get your blood pumping and get your muscles moving. That'll help you just be a bit more active during the workday, and then you can do these 3 exercises like vigorous walking, that sort of thing throughout the week. And then you can give them a list of healthier food options rather than consuming a lot of high cholesterol processed fast food options, if that makes sense. So there's ways you can implement the plan with the patient and educating them. And then you're going to come back and evaluate them. So for example, let's just say you're at a doctor's office and the provider's like, hey, I want to see you in a month. So then you're going to ask the patient, hey, can you do these things for me that we talked about in your implementing in the intervention portion of the plan, and then in a month we're going to come back and we'll reassess. So it's almost like the cycle starts back over again. So then you're going to reassess the patient's BMI, their cholesterol level, see if they're eating healthier, that sort of thing. See if you need to modify the plan in order for them to meet that new outcome, if that makes sense. I hope this helped, guys. Again, I find going back to the basics and sometimes just writing ADPIE out on my scrap piece of paper on my test, and if I come to a question that stumps me, I can be like, oh, wait a minute, I need to go back and actually assess the patient. We haven't fully done our full scope yet of assessing. So then I know that the question that is talking about going back and looking at the patient and whatnot is probably the question that I need to choose. So I hope this helps, guys, and good luck studying. You got this. Let me know if you guys have any questions. Please like and subscribe, and I'll talk to y'all later. Bye, guys. Good luck, future nurses.